We're continuing with our daily press briefings. Actually, today I'll be having two press briefings, one now and one later this afternoon. As I said, this is a rapidly evolving situation that we have, and so we're doing our best to keep up with it on a daily basis and adjust and be flexible as necessary. This morning, I have an incredibly important announcement, and I appreciate all the members of the press for being here to help us get the word out about this new announcement. I'm announcing that effective tomorrow, Tuesday, March 17th, until Monday, March 30th, dine-in food and beverage services at all restaurants, bars, cafes, coffee shops in Rhode Island will be shut down. Drive-through and takeout and delivery services can remain open. I'm going to say it again. Starting tomorrow, March 17th, through Monday, March 30th, all dine-in food and beverage services at all bars, coffee shops, cafes are being ordered to close. Delivery service and takeout service can continue. In a few minutes, I'll be signing an executive order to make this official. The Department of Health will be enforcing this. This is a serious step because we're confronting a serious crisis. In 2 weeks, I'll revisit this and make a decision in 2 weeks whether we can ease that or, frankly, whether we need to even shut down the delivery and takeout. But for the period of the next 2 weeks, this is what we are ordering the hospitality industry to do. In a few minutes, Dr. Nicole Alexander-Scott will be providing additional guidance around how restaurants can and should safely administer the delivery and takeout. I'm also announcing that we are restricting gatherings to no more than 25 people. That's a big change. It's a change from last week. This crisis is changing every day. So as of today, effective immediately, no more gatherings of 25 people or more. By the way, this is in line with the guidance issued by Massachusetts. I should note that I'm in very regular, almost daily contact with the governor of Massachusetts. Since we share a border, we're trying the best we can to align our policies. So no more gatherings of 25 people or more. I do want to especially thank Mayor Elorza, who's with me today and will be offering a few comments in a minute. I've invited him to be here today because in our constant contact with mayors and the mayor of our capital city, the mayor was very smartly moving in the exact same direction. And I want to thank him for his leadership. In a few minutes, he'll be detailing exactly what the City of Providence is doing. In addition to thanking him for his leadership, I want to thank all the mayors and town managers. We have a daily phone call with them, and I want to encourage every single one of you to follow guidance similar to what I've just provided and what the mayor is providing. I want to be very clear about this. We are directing all Rhode Islanders to avoid non-essential crowds. Eating out is not essential. Getting your hair done is not essential. It's important, but it's not essential. Hanging out with your friends is not essential. Going to the mall is not essential. If the RIPTA bus pulls up and you see it's full or half full or there's a couple dozen people there, do not get on the bus. Wait for the next one. Getting a massage is not essential. This is important, folks, and we're going to start enforcing this. As I've driven around yesterday, I saw 50 or 60 boys playing football together in a field. Shut that down. I drove by the mall, and there were far too many people there. Shut it down. It's not a joke. It's about keeping yourselves alive and helping us to make sure that our healthcare system isn't overwhelmed. I hear every day from doctors, nurses, hospital administrators, therapists, these folks are totally overrun. And by the way, they are working like they've never worked before, putting themselves in harm's way to keep the rest of us safe. We know right now we're staying ahead of it. We are staying ahead of it. We need to keep ourselves there. This moment right now is a critical moment to give Rhode Island a fighting chance to contain this as much as possible and ensure that we don't have that spike in cases all at once, which overwhelms our society and our healthcare system. So that's what this is about, and that's why these extreme measures are being taken. I want to make a special note to restaurant workers and those who own restaurants and bars that do takeout service and delivery. If you work in a restaurant, you cannot go to work if you're sick, even if you're a little bit sick. If you're tired, if you have a cold, if you have the sniffles, you cannot go to work, period. And we're asking restaurant owners and managers to please enforce this. I do want to give a huge thank you to the Hospitality Association. And we have Dale Venturini, who's the president of the association, who's here today. We have been in constant contact with the Hospitality Association and restaurant owners. This is a massive business sacrifice that they are making. I've worn my Hospitality Association pineapple pin today as an expression of gratitude and solidarity. Listen, I know this is brutal. Tomorrow's St. Patrick's Day. For many of you pub owners, it's the biggest day of the year. We'll figure out a way to make it up to you. You're doing the right thing. You are heroic in this effort. It's going to keep Rhode Islanders safe. And so thank you to Dale and to all of your members. Thank you so much. Know that you're doing the right thing, and we appreciate you. A few more things that I'd like to mention. Our unemployment insurance claims are starting to skyrocket. The same with our TDI claims. That's what we expected, and it's happening. So I'll make a few comments. Today, I will be submitting to the Federal Small Business Administration for an economic injury disaster declaration. What does that mean? That I'm trying to make it so that we are eligible to receive low-interest federal disaster loans designed to allow Rhode Island small businesses to apply for working capital loans to pay fixed operating costs through this period until we can return to some sense of normalcy. And I'd like to thank Mark Hayward, who is with us today in the back of the room. Thank you, Mark. Mark is the SBA District Director. He's been fantastic. He's here in Rhode Island and working very closely with us. I think Rhode Island is the first, or one of the first, to apply for this sort of disaster funding. We're going to work as hard as we can to get this money on the street as quickly as we can. But we're hearing from a lot of businesses, actually a lot of restaurateurs, who say, we hope to be returning to normal at some point in the near future, and we want to give you some liquidity so that you're able to keep the business open and help with paying for the fixed costs. So I've applied today. We're going to be working very closely. By the way, we're working very closely with our federal delegation in order to make sure Rhode Island is the very first state that has this sort of low-interest loans available to our small businesses. With respect to unemployment insurance, the best thing I can suggest is that you go online. If you call, the first thing that the person on the other end of the phone is going to say is to tell you to fill out an application. So we have, as of this morning, made it so that there's excess capacity. Go online. If you need to file for unemployment insurance, or for that matter for TDI, go online to the Department of Labor and Training's website, go ahead and apply, check that this is a COVID-related claim, and those claims will be expedited. And in this regard, I'd like to give a big thank you to the state's IT team, as well as Director Scott Jensen of DLT, who've been working throughout the weekend to make it so that, as of today, we have excess capacity online, and we'll do everything we can to get the unemployment insurance checks out to you as quickly as possible. A few other thoughts. I've been hearing from a lot of teachers and principals and superintendents. They want to know what's happening to school next week and then the next week. I would just ask you to hang on a day or two. We know what's happening this week. This week, there's no school in the state of Rhode Island. It's closed, and we've asked teachers and principals and superintendents to begin finalizing their distance learning plans. By the way, I know you're all working on it, and I'd like to say thank you. I'm asking for a day or two, and we'll be coming out with an announcement very soon around what we think is best and safest for school in the coming couple of weeks. Similarly, there are many questions around what we're doing here at the state as it relates to lobbies, the DMV, the State House, folks who need to show up at a field office to get cash payments or food benefits and food stamps. We have another press conference this afternoon. I'll be issuing additional guidance then. For now, what I'm saying is avoid gatherings of 25 people or more, avoid all non-essential meetings and human contact, and we'll be back out today, later this afternoon, with more specific guidance. With that, I'm going to turn it over to Dr. Nicole Alexander Scott, and then Mayor Elorza, and then we'll answer all of your questions.
Doctor, would you just pull the microphone and speak?
Good morning. Thank you all for being here. Thank you, Governor, for your tireless leadership and effort. Thank you, microphone, for behaving properly. Thank you also, Mayor Elorza, for your partnership and leadership with this. So I want to echo what the governor has said. It is critical right now that people not be a part of gatherings or crowds where there are 25 people or more. We also have to make sure that people stay home, stay local, refrain from engaging in non-essential activities, particularly where there are crowds. We need everyone to understand the importance of this. We need everyone to understand the importance of this timing right now. I particularly want to speak to the teenagers that are out there. We are talking to you as well. The point of all students being home is not to then go congregate someplace else at the mall or in other places. I will continue to share. The way this virus spreads is when groups of people get together and folks have symptoms of illness. That's all the virus needs. We are looking to stop the spread of illness, and that can only work with everyone participating. That's our teenagers, our students, and our adults setting the example. We have to act now to keep people healthy and safe and to limit the spread of COVID-19 in Rhode Island. Everyone has to play their part. Everyone does. So that's why we are now expanding to restaurants, to bars, cafes, any place where you go and you see a crowd of people, 25 or more. You can use a smaller number if you'd like. Avoid that crowd. Go someplace else, stay home, use a different time frame to go back out. Understand that crowds are what the virus uses to spread illness. That's why we are putting these directives before you. The governor announced about dine-in service at restaurants, bars, and cafes. We have been working to get additional guidance to people in the food industry. Everyone who works in the food industry or delivers food must stay home and not prepare or handle food for others if they have symptoms. That is critical. That is something everyone within food establishments know very well, and it's something that we have to be crystal clear about now. To cut down on the amount of face-to-face contact that people have, orders should be paid for online or by phone, by credit card, anytime that it is possible. There's also the opportunity to work with restaurants to be creative about having drop-off service or pickup service where you can come to the window. The goal here is to limit contact with multiple people again and again. The more we can do that, the better off we can be as a state. Food establishments have also been reminded of how critical it is that people practice appropriate hygiene and sanitation measures, especially at this time. So as mentioned, the Rhode Island Department of Health will be issuing guidance later today, particularly for food delivery service options and takeout protocols. I want to again thank restaurant owners, restaurant workers, Dale and the Hospitality Association. This is something that we will do together, and we very much appreciate the leadership of those in the restaurant and food industry who understand the importance, are taking the sacrifice together, and we need all members of Rhode Island to work with us. Regarding gatherings, as the governor has said, we're going to continue to repeat, we are restricting gatherings larger than 25 people. These are numbers that we're establishing really to reiterate the point. If you see a crowd, that's the best place for viruses to spread. That's what needs to be avoided. We should not be seeing teenagers out, group of 50 people huddling together. So we need everyone to heed this and to understand how critical this is. All you have to do, particularly while you're home now, is look online and check internationally what happens in countries where they have not been able to do this effectively. That's what we are looking to avoid. And we can do it if everyone heeds the guidance that's been put forth. We are being very aggressive because this window of opportunity is only open to us once. If we work effectively now, we can decrease how long this goes on for. In terms of data and our case count, I want to share what the updates are. Since the last time we communicated with you, we have had one additional case. This person is a woman in her 40s. She is currently hospitalized and is in isolation, but she is in stable condition. The Rhode Island Department of Health is currently investigating the source of her illness. This brings our total case count to 21. I also want to make an important statement about what we're seeing. Community spread occurs when you cannot immediately identify the source of illness. We have started to see cases where we have not been able to immediately identify the source of illness. To err on the side of caution and to help us stay 2 steps ahead of this, we are saying that Rhode Island has community spread. All the more important for everyone to heed the messages that we're saying. Virus spreads most easily in crowds. We need everyone to stay home and only go out for essential needs, please. Before stepping away, I want to reiterate our critical personal prevention measures. If you've traveled anywhere internationally in the last 14 days, self-quarantine for 14 days, that means stay at home, and monitor for symptoms of illness, fever, cough, shortness of breath. For everyone, whenever possible, avoid close personal contact with multiple people in public. When greeting people, avoid handshakes and hugs. Let's keep the elbow and fist pumps going. People who think they have COVID-19 should call their healthcare provider. We are working closely with healthcare providers to handle how to provide recommendations to you. I want to reiterate, if you have symptoms of illness, cough, fever, respiratory symptoms, shortness of breath, if you are able to stay home and recover, that is the best thing. Testing will be important for people who have severe illness and need to go to the hospital. Whether it's COVID-19 or the flu, the treatment is the same. If you can recover at home, please do that. That's the way to keep illness from spreading. People with general non-medical questions about COVID-19 can call our COVID-19 hotline. That phone number is 401-222-8022. Again, it's not too late to get your flu shot. That's critical. We've spoken today about preserving our healthcare system for the people that need it. A flu shot is one of the many preventive measures that can be done to keep people out of the hospital. Wash your hands often through the day. Use good cough etiquette. Cough or sneeze into your elbow. Avoid touching your eyes, nose, or mouth. That's how germs spread. All of these measures I have discussed and that the governor has mentioned and what you'll hear from the mayor all have an impact. We also really want to protect our older adults and people with underlying medical conditions. Those who are vulnerable are the ones that we need to monitor for. Finally, I want to acknowledge that there are a lot of questions out there. Teachers and parents want to know what's happening with school next week. You've already heard from the governor. We're going to continue to work with you. I want to also give that message to our primary care providers who have been on the front lines and doing the best they can. We appreciate you. We'll be talking to you later this afternoon as well. And I want to turn it over to Mayor Elorza. Thank you.
Thank you, Doctor. Good morning, everyone. I want to thank everyone for joining us and to the media. Thank you for helping us get this important information out on a timely basis and a recurring basis to all of our residents in the city and in the state. I want to especially thank the governor and her team for her leadership in this moment. The federal guidelines for communicating during a public health crisis say be first, be right, be credible, show respect, and promote action. And Governor, you and your team have done this throughout, and we appreciate the partnership. I also want to recognize Council President Sabina Matos, who's been a valuable thought partner for me and has been with us every step of the way. So thank you for your leadership on this as well, Council President Matos. And finally, I also want to recognize the hospitality industry. We know how deep of a hit this has been and likely will continue to be. But we appreciate your partnership in recognizing that this is important for all of us. As you know, and as we continue to hear from our health professionals, we are at a crucial and critical point in mitigating the impacts of COVID-19 within our city and state. We've continued to call on our residents, our business owners, our community partners, everyone to do their best in keeping our families, neighbors, and city safe from the spread of the virus. And I want to take a moment to thank everyone for their cooperation. I especially want to recognize our first responders, our clinicians, our public health officials, all of them who are working tirelessly and around the clock to keep our community safe. We're grateful to all of our public employees for their dedication. We thank everyone throughout these trying times. As more and more tests become accessible locally and nationally, we are now beginning to see the full extent to which this virus is impacting our community. We find ourselves still in this moment of what is called exponential spread or exponential growth. Based on the experience of other countries, we know that this time typically takes, on the shorter end, 5 to 6 weeks, and on the longer end, 8 weeks and counting. And the extent or the length of that exponential growth is entirely dependent on the social actions and the steps that we take to limit social interactions and hence the spread of this virus. In other words, as you've heard throughout, we need to do everything we can to maintain social distancing, and through that, we will flatten the curve. It's amazing how fast things are changing. And just last week, I announced that the City of Providence was taking emergency measures What seemed bold just a few days ago now seem quite quaint. And as this virus continues to spread, it's important for us to take additional measures to continue to support and protect our community. I know that these changes are hard on so many of us, but so many of our businesses have already risen to the occasion. We've continued to monitor compliance to these restrictions, and we hold the public health and safety of our city as the #1 priority under these circumstances. Effective immediately, I will be ordering my police department and our public safety officials to ensure that we ramp up monitoring according to the guidance and the directives given by the governor to make sure that there is compliance, that restaurants, bars remain shut, and that gatherings are maintained to less than 25 people. We want to truly ensure that we're being safe and encouraging practices that will help us mitigate the spread. And with guidance from our public safety and public health officials, I'm prepared to use our forces, use our resources to, in fact, stop all on-premises food and alcohol consumption at restaurants in the City of Providence per the governor's guidance and directive. We also believe that limiting gatherings of people to 25 and less for the next couple of weeks will help us in this effort that we have as a community. Though it will be difficult for many of us, it's necessary in our efforts to contain the virus. In addition to the restrictions which you've just heard, beginning tomorrow, Tuesday, March 17th, I'm also requiring that Providence Place Mall close until further notice. We want to eliminate the highest risk areas within our state, and frankly, we also want everyone to take this seriously. This week, as kids are out of school, and perhaps some families are out of work, we do not want them to congregate in these public spaces and create the circumstances that are ripe for transmission. We need everyone to take this serious and do not leave your house unless it's for an essential reason. We have been in communication with leaders of our business community, and we understand the strain that these circumstances have had on their businesses. And while most people have complied, this past week we were forced to shut down 2 businesses that were not complying. And anyone who does not comply going into the future, your actions are irresponsible. You need to take responsibility, and if you don't, we will shut you down accordingly. As the capital city, this has already taken a palpable toll on the way we do things in our city. I'm not saying that residents and visitors should stop supporting our businesses, but we should do it responsibly in accordance with the governor's guidelines and directives. As we watch this crisis develop and spread in communities similar to ours, we can't stress enough to anyone who isn't yet taking this seriously, or to any young or able-bodied person who thinks they could just ride this out even if they get the virus. This is not about you. You all have a responsibility to your entire community, and you have to do everything you can to prevent yourself from getting it so that you are not unnecessarily spreading it to others who might be more vulnerable. Remember, we all have parents, we all have grandparents, we all know someone with underlying health conditions that might not be able to survive and might not be able to withstand having the virus. As a thriving and densely populated city, we need to take every precaution that's necessary to contain this virus in our community and in our state. My team and I will continue to be in close communication with the governor, her team, and all the public health officials. And we'd also like to take this opportunity to remind you to limit all non-essential travel and to self-quarantine should you be returning from an international flight per the governor's direction. You can find accurate and timely information on all COVID-19 efforts by going to our website in the city, pvdcovid19.com, or reaching out through our PVD 311 system. Anywhere in the city, just dial 311 and you'll be connected with my office. The Mayor's Office for Constituent Services will remain open from 8 a.m. to 8 p.m., now 7 days a week, through March 30th, to help residents with any questions or concerns that they may have. And last, should you feel sick, please call your primary care provider first or the Department of Health, where you can be evaluated and tested if necessary. We ask everyone to take this seriously. It is a global pandemic, and whether or not this continues to spread is in the hands of all of us as Rhode Islanders and throughout our city. We ask everyone to please continue to cooperate. We'll take any questions at this time.
Governor, what will the state do about supermarkets? They've obviously been seeing above average business, so what about the advice to avoid crowds of more than 25?
Yeah. So I would say it's the same advice, right? Going out for dinner is not essential. Eating is essential. So folks should still go to the grocery store, the pharmacy, the bank, doctor's appointments as absolutely necessary. However, it's the same thing. If you go in and there's a crowd, come back later. As Dr. Alexander Scott said, you need to avoid crowds, close contact, extended contact. Better to go for 15 minutes than an hour to the grocery store. And if, don't get too close to people in line. And as I say, they're going to stay open. We've been in touch with the grocers. They are open. They will stay open. They will continue to keep replenishing their supplies. So there's no need to hoard. There'll be food. And if you walk into anywhere, and you see a crowd, turn around and go back later or go back tomorrow.
Doctor, what is it that kicked this over to you categorizing this as a community spread?
We have started to see cases where we have not been able to immediately identify the source. The primary reason that happens is because someone has attended an event where there is a crowd and in public places where they're not able to identify who the other people are so that we could make the connection. So to stay in front of this, we're saying that this is community spread, and we need to focus on the containment that we are doing. That has to be amplified even further. In order to do that, you need to avoid crowds. You need to understand why that's the requirement, and to understand that that's how the virus spreads.
Doctor, does this affect the testing protocol in any way now that we're at community spread? Does this affect who can get tested?
It impacts the ability to test the number of people, mostly because of the supplies scenario that we have. And what we want to really focus on is for people to understand the necessity to stay home if they have illness or symptoms. Whether it's the flu or whether it's COVID-19, testing will not change what the treatment is. And so being able to stay home, recover safely, drink fluids, rest, avoid spreading illness by going out is what the message is that we want. And we will continue to focus our testing and the expansion of testing on those who are at the highest risk, people who are hospitalized, healthcare workers, including EMS, and those who are in congregate settings like nursing homes. That's where our risk is most vulnerable. We will absolutely be continuing the testing for that as the focus, and we want to make sure everyone understands what's needed for those that have mild illness.
How many people are hospitalized now? Is it just the latest case, or has that first case been released from the hospital?
The first case was discharged from the hospital, and we have the one case hospitalized now.
Doctor, what is your models showing you in terms of what percentage of the Rhode Island population may come down with this disease?
We are still refining that specific percentage, but overall, nationally, internationally, the numbers are showing 60% or more of the population. We also understand that 80% may have mild to moderate illness. But as the mayor articulately shared, we need to make sure that even those with mild to moderate illness are not out in crowds spreading symptoms, spreading illness, spreading the virus to people who are more vulnerable. If you have underlying diseases or if you're a senior, the risk that you have is higher. And we need to make sure that crowds are avoided. People 60 and older are out and about, and those are the ones we are referring to in the situation as seniors. I know that's challenging for some. 60 and older, we need you to be able to stay home and protect yourself. Those with underlying illness as well.
In the mall at your recommendation, and what do you say insofar as other malls or other large shopping areas in the state?
We want to stay consistent with that message. Crowds of 25 or more, or even smaller crowds, are where the virus spreads. So we very much support the closure of the mall, particularly if that's where people who are not in school feel like they can go if they don't want to heed this critical message that we're saying. And we certainly encourage that for others as well. This is the critical time, and for you as media to really help get the message out that this is serious. This is not an overreaction. We have the opportunity to change the course of this disease as long as everyone heeds the recommendations and the requirements that are being stated.
As far as the 25 or more public gatherings that's now in effect, we've got a lot of people that are asking about the DMV specifically, or other municipal buildings, state agencies. Does this apply to any or all of them?
It does. It does. Again, if you walk into any place and there are 20, 25 people, you should not enter. You should not go in there. Having said that, at 4 o'clock today, we're going to have another press availability, and I'll be providing much more detailed guidance as it relates to lobbies, state buildings, municipal buildings, et cetera. To answer the question about Mayor Elorza, again, I want to thank him for his leadership and the way he's moved swiftly. We have been working in concert, and as have we been working in concert with all the mayors. We have a daily phone call. My answer would be yes, I would encourage the mayors who have malls in their communities to go ahead and close those malls. The same thing with liquor licenses and shutting down the bars in their communities.
So just to be clear, as we stand right now, areas like the DMV, they're still open. You're recommending people not to go, but are you hinting that we could be shutting down municipal or
What
the DMV
I'm saying,
tomorrow?
right, so what I am saying is, you know, you could ask me about every single thing, you know, like spas, barbershops, you name it. So I'm saying, use your judgment. Is it essential? Do you absolutely have to go to the DMV today? Probably not, so don't do it. Do you absolutely have to go wherever today? If not, don't do it. As I think about how we're responding to this crisis, I think of it like this. We can't get out of it. It's here. We're living with it. We're dealing with it. If we make smart decisions now, it'll help us in the long run. If we don't, if we try to, you know, stretch the rules, you know, go out even when we shouldn't, it's going to last longer. The economic toll will be much greater in the long run. More people will get sick, and we need to avoid that. So later today, I'm going to have crystal clear guidance around which buildings will be closed versus which will stay open. But what I'm telling you now is, if you show up someplace and there are a lot of people, get back in your car and go home.
So in terms of taxes and stuff, and just following up Jared's question, is that guidance going to be in that press conference later today? If, like you say, if it's essential to be at the DMV today for somebody that's waiting online right now that may owe a bill, you know?
We're working on that. So there are, as you can imagine, dozens, if not more, rules, deadlines that, and we're going through one by one. I would say right now, as a general matter, we're going to err on the side of leniency. So if between now and 4 o'clock you have a decision to make, stay home.
Who enforces the public gathering?
We are going to be enforcing it. We will be enforcing it. The Department of Health is going to be enforcing this on a, like I said, when I signed the executive order, this is an order. This is not a suggestion. This is an order. We are shutting down restaurants and bars for dine-in service. Again, I want to be really clear. It'd be great if we supported our restaurants in this time, so pick up and delivery is okay. So the Department of Health will be enforcing that, and all the mayors will be enforcing it as well. You just heard it from Mayor Lorza. He is directing his public safety workers to enforce this. Every other mayor will do that. Our state police will be doing that. We're going to get more and more serious about this if we see that people aren't heeding our directives.
Have you given thought to closing state government? And where might that decision lie along the
We are
timeline?
working through it now. Many state government services are essential. You know, people rely on getting their food stamps in order to get food and be able to eat and feed their kids. Health care is provided. So we are going through in a systematic way to figure out what's essential and what's not, and I'll have more guidance later.
Governor, on the restaurants, Governor Baker adjusted his ban on the restaurants from 30 days, cut it down to earlier in April. Did you consult with him before announcing how you wanted to move forward with restaurants?
Yes, we're all talking to one another. I would say this, although that's helpful, I'm also really taking my cue from the Hospitality Association and restaurant owners who are here on the ground. To have done it for 1 week, I mean, people do need to plan. So 2 weeks felt like some amount of time so that people can plan. Having said that, this is changing by the day. So at the end of 2 weeks, I'll have some more guidance.
Did you find a way to make it up to them?
Yeah, somehow we will. In the past, my husband and I have done the redo date for Valentine's Day, if it snowed on Valentine's Day. Look, tomorrow's St. Patrick's Day. If you own an Irish pub, this is terrible. There's no sugarcoating it. So absolutely. I don't know exactly, but we're going to go as far as we can to make it up to every one of them. I don't know. Maybe we could reschedule St. Patrick's Day for a summertime. We'll see.
Reopen Memorial Hospital.
All of this is on the table, so I will address that. So I have activated the state's Emergency Operations Center. It's a 24/7 operation. I've put General Callahan of the National Guard in charge of the state government response. Top of our list right now, we're meeting later today, is surge planning. So we are doing what-if scenarios. What if we need 100 more hospital beds? What if we need to quarantine 300 people at once? So we are going through cataloging all of our available space, Pawtucket Memorial, but there's many other areas, trying to figure out if a week or two or a month from now we need these facilities. The same is true for people power. We need boots on the ground to deal with this. I will say, and if anyone in the Trump administration is listening, I want to say this very loudly and clearly. We need a better response from the federal government. We need faster access to our personal protective equipment, masks, goggles, gloves, etc., to protect our frontline healthcare workers. I am out of patience at this point. I don't know how to get through to them, but I really hope someone at the CDC is listening and gives us further access to our stockpile. We are in okay shape right now, but this is not okay how the federal government is responding to this, and we all need to raise our voices because these physicians and nurses on the front line need to be protected. We're in fine shape now. We are asking to have further access to it, but it's days, not weeks, Ed.
Can you tell us how many ventilators are available in Rhode Island? And if you have none?
We have a few hundred ventilators that are available in stock. There are some that are active right now, and it's something that we are monitoring on a daily basis in communication with our ICU doctors.
Does that include the National Guard supply?
Yes.
Doctor, can you just talk about why the state is not disclosing where these presumptive positives are located, which communities they're in, or even which hospitals these patients are being isolated in?
We want to protect the confidentiality of the patients and families involved. What's most critical is for people to understand what they can do, and that's what we're talking about on a daily basis. Number one, if you are ill and with symptoms, you need to stay home. The community transmission component further emphasizes why we need to focus on containment and knowing and supporting people staying home if they're ill.
Governor, what is your thinking on whether the April 28th presidential primary needs to be delayed?
My present thinking is that we will not delay that, but we are in discussion right now around how we can safely have that election, specifically if it could be done all by voting at home and mail ballots. I'll have it. That's from where I'm sitting. That is an eternity away because that's more than a month away. We're trying to get through today and this week. But my answer to you is right now we're going to keep it where it is. By the way, every other state, New York's doing that, New Jersey's doing that. I've been in touch with those governors, and I'd like to see if we can move to, in an ideal world, we would move to an all-male election.
As far as the unemployment, reimbursement that workers might, especially servers now at this point, might be able to apply for, do we have enough to actually accommodate them all? And what they would get in a week, does that come anywhere close to their average weekly take-home pay?
So, no. I mean, unemployment insurance does not cover the entirety of the lost wages, but it's something. And fortunately, our unemployment insurance fund is very well funded, very well capitalized. But again, it depends on how many people file for unemployment insurance. This is an area that the federal government absolutely 100% must step up. I've been told by our federal delegation that today or tomorrow the Senate is likely to pass the bill. I hope the president signs it quickly. There is a component of that for unemployment insurance, but it's only $500 million for the country. So I would say if you need unemployment insurance, go online, file, and we're going to get you the checks. We're in good shape here in Rhode Island, but a week from now, I really hope the federal government has passed some sort of a stimulus package to help states with replenishing unemployment insurance coffers.
Governor, the Small Business Association Economic Injury Disaster Declaration, would that be something that small businesses may be able to recoup or have insurance for payroll, rent, immediate needs right now?
As I understand it, it is mainly for working capital. So it's mainly access to liquidity quickly at very low interest so they can fund their operating expenses over this period of time while their business is soft. So it's mostly for that.
Governor, just real quick, if you can, why the decision to have kids go with their parents to pick up the school lunches at the designated sites?
I'm sorry. Say that again.
The kids are going with their parents. Anybody that has a meal, they're going with their parents to go pick up the lunches at the schools or the designated sites. Or was there a reason why that decision was made?
That is being handled, as I said yesterday, on a city-by-city, town-by-town basis. So each, and again, I want to thank Mayor Lorza because he stepped up very early. If you're an elder and you're used to going to a senior center for food, or you're a kid who gets your breakfast and lunch in school, check with your town in order to see how you can get food in the next couple of weeks.
So can I speak on
Yes,
this?
please.
So two things on the school lunches. So we've been working with the school department, with RIDE, and with Sodexo, and we will be providing both breakfast and lunch at 8 locations throughout the city, dispersed so that we're meeting people where they are at. And anyone who's a school-aged child living in Providence will be served. We understand that that's breakfast and lunch, and it leaves out dinner at this time, but we are working furiously to fill that gap as well, and we're working with all our partners. We should have that up and going within the next couple of days, so we're prioritizing that. I also wanted to speak on one other issue, and I ask for everyone's help in helping to clear this up because there's been a lot of misleading information about it. There's been a suggestion that 80% of the time that this is that you experience mild symptoms. The gentleman who first reported that has been talking throughout the country and explaining exactly what that is. That comes from a study from China of 4,500 patients where they categorized people into 3 separate categories. One was critical, one was serious, and one was mild. Critical being potential organ or lung failure. Serious being they need a ventilator. And then mild was everything from truly mild symptoms to needing hospitalization. So that 80%, when people say that 80% is mild, mild does not mean mild. Some of those 80% are extremely serious cases, and so we shouldn't have anyone dismissing or minimizing the risks here. This is a serious virus, and we need everyone to take it seriously.